Today, we have a special guest here that I'm excited to talk to. I'm not excited about the subject matter and that you have had bad experiences, but I'm thankful that you're willing to share your story. So, first, can you just tell us a little bit about yourself, where you're from, or what you do, or whatever you're comfortable sharing?
Well, hello, I'm Jessica. And here we hear little mommy in the background. Yes, I'm a mom. I grew up in Wisconsin and I loved it there. And I moved to Indiana 2 years ago. And it's been a good change, but I am a Midwestern girl at heart. I've lived in Chicago, I've lived in New York City, moved around a lot.
And then, who's your special guest that you have crawling on you as well, just
Well,
so we kind of know?
this is Sophie.
Hello, Sophie, with the pretty curly hair. Well, you can join us whenever you want, Sophie. Okay. This is mom friendly, two moms here, mom friendly life. Let's
Mhm.
get right into it, I guess. When did your needle nightmare happen and what happened?
Well, I think so. We've talked about how I'm a mom, and my middle child, she is almost 4. And I became aware of my needle problems when I was pregnant with her. And it started right away. Even when you find out you're pregnant and you're like super excited. And I was going to a fertility clinic and they're like, okay, we want you to come in and get your HCG drawn. And so I went up there and the woman was having a hard time trying to draw me. And so she poked me a couple times and then she went and got the little, it was like a machine. And I know we've kind of discussed like, was it an ultrasound? Was it a light? And I can't quite remember what it was that she used on me to help her be able to do the lab draw. But I
Mhm.
remember her getting that. And at the time, like I didn't think of myself as a difficult draw. And then with the HCG draw, they're trying to like track all your numbers progress. So I
Yeah.
had to come back in a few days. So I was there, I think like a Saturday morning doing the first draw. And then I went back on like Monday or Tuesday. And I go to the lab area. And this other woman takes me in and she tells me, she's like, oh, the other woman went and hid when she saw it was you because you were such a difficult draw.
Oh dear. Did the second woman get you right away, get your labs right away then?
I think so. She obviously wasn't as memorable of an experience, but
Yeah.
that was the first time I kind of like heard that label, like that I was
Okay.
difficult.
Oh, okay. Yeah, somebody
And
running away from you. Yeah, that's pretty like, okay.
yeah, that, this woman felt bad that it took her so many attempts to get my labs. And you're like, this is like an exciting time in your life, right? Like you're so excited, you're pregnant, like,
Yeah.
and then it was just kind of like weird, right?
Um,
So that kind of like started it. And I had so many lab draws that pregnancy. I looked like I had track marks on my arms
yeah.
because of so many pokes that I had. Because I was doing some lab work for hematology. And so I had all these pokes. And then at the same time, when you do like your gestational diabetes test, you're getting multiple draws as well. I just remember all the bruises.
Yeah.
And then finally, for my scheduled C-section, I'm at the hospital and they want to put an IV in your hand. And I'm left-handed and they wanted to put it on the left side and I really didn't want it in the upper portion of my hand, but they're like, "No, that's where they like to place them." Because I wanted it back further and I'm like, "Okay." And then the nurse, she hit a nerve,
Oh, and you
placing the IV.
knew right away, like,
Oh my gosh, it burned. It burned so bad. Like
mhm.
it hurt. And obviously she knew that like this had happened. And so she, disappeared. And then the anesthesiologist came in and
So
he
she
placed
hit a nerve, but stopped the procedure at
he,
least.
well, yes,
Or
because I was like, I'm like, it's burning, it hurts really, really bad. And so she knew then
okay,
that a nerve had been hit.
okay.
Then, it's like, who's going to place the next one, right? And someone else came in and like, they were able to place the IV further back. And then the anesthesiologist came in and he placed another one because I needed two IVs for my delivery because there was, I may have had placenta accreta. And so they
Okay.
wanted to place two of them in case they had to put me under.
Yeah. Okay. High risk of bleeding and all of that. So, okay. Backtracking to that first experience when they used whatever technology, either a light or an ultrasound, they were successful when they used that technology the first time. But
Yes.
it's so interesting because as soon as when you're talking, I'm like, why didn't they use that the first poke? But I guess at that time you didn't know you were quote unquote difficult. You kind of learned at that time. But then did they use that? Did you have to have that technology used again for lab draws, or was that only time that you remember?
That was the only time it's been used on me.
Okay.
And it makes me wonder, like, is that equipment not available at all labs?
Yeah.
Was that just because I was at a specialized facility?
Because they clearly had it, but not as like uh, a first step, a
Right.
first resort. It's like a last resort, which is always fascinating to me because if you have tools, like if you're going to fix your car, you wouldn't not use tools. You would use tools instead of your hands to fix. It's good to hear they had some type of technology, but then it's frustrating. Why wasn't that used up front versus, okay, now it's been 3 times, so let me go get it, which is a pretty standard experience for a lot of patients, from what I hear.
Mhm.
Eventually, they got somebody that could get it. Eventually, they got a tool,
Mhm.
and it's like, why aren't we doing that first? Okay, so that was that kind of first realization when you were quote unquote difficult. So then fast forward and you had that experience in the hospital. So that was, you had multiple people. So then the nurse, assuming a nurse that tried
Mhm.
and hit the nerve, which honestly
Mhm.
I'm thankful to hear they stopped because I don't always hear that from patients. They'll be like, it hurt, and they just kept going. So thankfully she stopped. Um, and then had anesthesia come. And when you say the location, so they were placing it farther back, meaning up your arm, or
It was still in my hand, but he used on
oh,
a different spot. And so because they hit a nerve on my hand, I
yeah,
have puffiness there forever now. I have a numb spot on my hand now.
still.
Like
And this was how long ago?
that was almost 4 years ago. And like post operation, I had a C-section. Someone cut open my body, removed a baby, and the pain from that was less than where that nerve damage was. I remember still having to take ibuprofen and Tylenol because of my hand. My
Wow.
incision wasn't hurting anymore. It was the pain in my hand. And it's
Oh,
just something I had to deal with. Like, who do I complain to?
I was gonna say,
Like,
did they give you they gave you Tylenol and ibuprofen, but like, did give any instructions or follow up about what to do with your hand, or it was just like nobody cared?
no.
Yeah.
Like, other than like having the IV, the next IV then placed in a different location in my hand, and like the acknowledgement that, like, yes, they hit a nerve in my hand, like, it was never brought up again.
And no follow-up care or, try this or physical therapy or just anything to address the nerve damage or what to expect. And yeah, nerve damage is not a minor thing. And it was in your dominant hand or your non-dominant?
Mhm. My
Yeah.
dominant hand.
You still have an area where you can't feel, or how is it today?
Yeah. Yeah. I still do. Like, I have a spot on my hand.
It doesn't hurt, it's just no feeling. Like that nerve is
Yeah. Like, sensation is like it feels weird. Like, if I poke that spot, like,
wow.
it's kind of
That's
like numb
great.
a little bit. I mean, oh, for me, obviously, I had a C-section. I followed with my OB, and I remember just mentioning to him, but like, he doesn't care. It has nothing to do with the site of the surgery, right?
Yeah. Really could have just been avoided. And it could have been avoided with ultrasound use, but it sounds like nobody brought that up or mentioned that. The anesthesia didn't use an ultrasound that you remember.
No, I mean, he went in there. He knew what he was doing. Like, I
Yeah.
think someone had placed one in my hand. He's like, "Oh, I don't like that position," and he placed another one. So yes, I got poked multiple times.
I guess I'm glad to hear you didn't like that position, but also like again, there's no standard that they're following. Everybody's kind of just doing what they want, where they want. Interesting. Okay. I mean, those sound like a couple nightmare spots, and I can't believe we still have that damage, how many years later. Like, it shouldn't be part of it to get nerve damage in your hand when you go in for labor. You had a safe labor and delivery at a C-section, but you still left with harm from one of the most common procedures in the world still caused you damage. We have enough tools to know how to not cause damage with that. So I'm just very sorry to hear about both of those situations. Have you been, quote unquote, a difficult access then since that time?
I just assume it'll be difficult, right? So I try all the things, like I make sure I'm hydrating enough before I go in. Because that's whenever, like, I call my mom afterwards. I'm like, ah, mom, they poked me so many times. And she's like, well, were you dehydrated? Did you drink enough water? Right.
I always tell my patients because, they're like, what can I do? And if it was as simple as drinking water, I would be out of a job. I mean, that would be great if everybody could just drink a certain amount of water and then you'd have beautiful veins. Does it help? Maybe. Does it hurt? No, of course not. But like, it's not that simple.
I think I just assume every time that it's going to be bad. And this is going to sound so judgmental, but if I get in there and you get the feeling that the person's new, I know it's not going to go down well.
Yeah. And I'm sure you can tell, like you've been through it enough. Do you feel like you can speak up when you can tell they're new, or do you say I'm a difficult access?
Well, the one lady, when I knew she was new, and then, you put the needle in and nothing's coming out. And then they try again and it doesn't go down well. And then she goes to get someone more experienced. I mean, that time I remember just like laughing it off. I'm like, yeah, I got the feeling. And then the more seasoned person came in and it was fine. I remember that was a draw that I had. And just a few weeks ago, the woman, she was experienced, but it took her 3 pokes. And like, I now know if you're going to dig around with a needle in my arm, it's not going to feel good for me and it's going to bruise me. So I know enough to say, like, hey, let's stop. Let's not dig around. Let's
Yeah.
try the other arm. But at this point, like my arm, it hurt. And like I wasn't trying to cry. My body just started producing tears. And like, I felt bad because, like, she was very apologetic. I'm
Yeah.
not trying to cry. It's painful. And
Yeah.
then your whole arm hurts for the rest of the day.
Well, and here you are, the patient, going there to get help. I mean, getting poked with a needle isn't the most helpful thing, but obviously the outcome is meant to help, but you're the one crying and then you're apologizing because they feel bad, or you feel bad and
Mhm.
they feel bad, but it's like they should be crying and saying, I'm so sorry. We as the healthcare providers should not be making you cry. There's either a competency problem or maybe they don't have the right tools. Like you said, the light or the ultrasound that was used in the past.
Mhm.
Wouldn't it be great that everywhere you go, you just come in and say they usually use this and then it works, instead of these 3 pokes.
Mhm.
So it's very gracious of you to apologize to them, but you can't help how your veins are, and we have enough knowledge to fix these problems, but most facilities don't seem to know the tools that they need or protocol in place of, hey, you're a difficult access in the past, so this is what we're going to do. We're going to get somebody really experienced. We're going to warm up your arm to dilate the veins. We're going to listen to you where you tell us to go or not go. We're going to use technology. It really should be 1 poke. And I'm just so sorry to hear that it just isn't most of the time. How has not just that experience, but all of those experiences, has it changed how you feel about healthcare and your trust in healthcare with these experiences? How has that affected you?
Well, I think for lab work in particular, I want to put it off, right? I wait that last possible moment to go in to get a lab work done. And I find that when you go in to get them done, if you have somebody who's experienced, you can tell. I remember in particular this one lady, it took her a while, like taking her time, feeling around.
Around meaning
Yeah,
liver.
with her
That's
finger,
that.
feeling. And I remember her because she said, she's like, I only like to poke once,
Yeah.
right? And I appreciated that. So there have been positive experiences as well, but that was because that was a seasoned person who's
Yeah.
like, who wanted to do it the right way,
Yeah.
right? And took the time. Unfortunately, when you go to the hospital and you get labs done, you don't get to pick who's going to draw them,
Yeah.
right? You're just at the mercy of whoever called your number.
Yeah. Yeah.
And when you're walking back to your room with someone, are you really going to ask them, well, how long have you been doing this? Do you feel confident? Like,
It's so
this
hard.
person could stab you. Okay.
It's so hard and so true. Yeah. But, obviously, like, think about bigger procedures like surgery or like a procedure in general that's more invasive, you would want to know how long have you been doing it. But for this, it's so much more common and it's the most common procedure in the world. It is so quick. I don't know if we all just get a little bit like, you know, don't have as high of standards or high of expectations. You, especially as a patient, you deserve one poke, like one and done. 2025, we have the technology and ability to make that happen. And why aren't we?
So, what's the solution there? And what I have discovered is that cancer centers are amazing, by the way, not only the work that they do, but their phlebotomists, top
Yeah.
notch. And so
So,
I think I will just go to the cancer center for all of my future labs.
so they will take a non-cancer patient at a cancer lab or not sure? Like,
I'm not sure, but I'm sure going to find out.
okay, you'll have to let me know because I agree just from what I've heard from patients and know that cancer center labs are more they're used to dealing with more difficult sticks all day, every day versus like an occasional, maybe at a regular lab. So, okay. Well, you have to let me know if there is a barrier to doing that because maybe cancer center labs should be for oncology patients and also difficult access patients that don't have cancer, but opening
Mhm.
up that skill. That's a good logistical. I hope it works. Um, so if you, and that's, I guess that's my next question is like, if you could redesign these experiences that you've been through, what could you change?
Some sort of like patient education. Like you would trust though that the person doing your lab has been educated to identify that this person's difficult and this is what you need to do and this is what you need to ask for, right? But clearly my experiences have shown that the people who are trying to do lab draws on me are not being educated in that manner. I don't know if that's like a continuing education thing that happens at hospitals. Is it something that's changed in the curriculum at the schooling level? I don't know, but there clearly needs to be a refresher course there.
Yeah.
I think so. That's kind of like the angle from what the facility can do for its staff. As for a patient, even something so simple as a little sign in the room. You know how they have the pain sign, like "How are you feeling?" and scale of 1 to 10.
Yeah.
Is there a sign that says like, "Hey, if getting your lab done, these are things you can ask for.
Yeah.
Like this is acceptable." Like,
Yeah.
or maybe like this facility has YZ available for lab draw if it's needed. If I knew that like little machine was available to help find my veins, I would ask for it.
Yeah. Yeah.
Or like if there's a hand warmer that can be cracked and put on my arm before they try to find my vein, I would ask for it. But I think as a patient, we don't know these things exist until we've already been harmed, and then we know to ask about it.
Yeah. Yeah. Heat, there's so many things I want to talk about, but heat. So what percentage, I mean, do they never use heat? Do they sometimes use heat? What's your experience been with getting heat to dilate the veins, and has that helped?
I think one time it was used on me. And that would also be after like failed attempts, right?
Oh
Like
my
someone's like, okay, let's try this other.
God. Okay.
Yeah.
So I would say yes. I mean, I hate to hear that. But yeah, in general, that's what I tell my patients, when they're at a facility that doesn't have experts like me and my team,
Mhm.
um, say, because almost no matter where you go in the US, you probably have a towel somewhere and a sink with hot water. And if you just put hot, wet towel or some type of heat on an arm to help dilate those veins, try to find those veins a little bit easier. It also has been shown to help with pain reduction. So that's kind of a separate bonus, but that should be pretty standard for somebody that's difficult. It
Yeah.
just tells me like how behind, sadly, the best practices those facilities are which is not to say just the places you've been, it's pretty universal from what I hear from patients. And I'm always educating on ask for heat in some way, shape, or form, when you're wherever and you don't have experts like us. So it's such a simple intervention that could really help. So I'd encourage you to advocate for that and see if that changes it in the
Mhm.
future. Let me know. And I think that's a really good idea about like a sign. It shouldn't come to that, right? They should say, hi, these are all the things that I can offer you. Or they should just know, looking at your veins, I can't find anything, or it's not obvious. So I'm going to get some heat now. But every place is different with what they can can offer. Even essential oils is a big thing now that's shown to improve pain, heat, music, distraction, so many ways to make the process better, but most places aren't using it. And you said, so heat was used maybe once, and then the technology of ultrasound or that light or whatever was only used once too, like in all of your
Yes.
claims. Oh my God, I'm so sorry to hear that. That's so frustrating.
I need to advocate more for myself. And this last straw, like she went and grabbed like a butterfly that she said you would use on a kid. So I think in the future I'm going to ask for a smaller butterfly needle. Because I asked her, I was like, what does butterfly mean? And then, she explained to me that it would be a sharper, smaller needle that you would use on a child. So now I know
And that
that I can
worked.
ask. And it worked. And so maybe I'll ask for that in the future, ask for the heat.
Yeah.
Yeah.
Yeah, and just every system is different as far as how they document these things. Electronic health record. Do you have a label of difficult in there? I don't know. And even if you do, are they going to find it or see it? Or, that's a whole other thing that needs to really be improved of how difficult are your veins that we jump to these interventions first versus three pokes in. You advocating, again, it shouldn't come to that, but you advocating and saying, I've had a difficult time in the past, gets them ready sooner. Again, you shouldn't have to be that blunt, but I would definitely
Mhm.
encourage you to be that blunt. Like I said, keep me posted with all of this if you do have better or worse experiences.
Will do. I think it's hard with like the way the healthcare system has changed, where now the labs are all outsourced, like everything's owned by this outside company. And I have found that it's just become extremely impersonal. Like now it's like you schedule your appointment online, you do your pre-check-in online, you get there and you click on your phone on a box. Like your human interaction is now so limited. So by the time I see this person who's going to stab me now multiple times with a needle, it's so transactional.
Yeah.
Like it's like I ordered a coffee,
Yeah.
right? And you're someone who could hurt me and cause me pain
Like you
and
have
has hurt
caused
me,
permanent damage. Hmm.
right? So it's getting weird. I don't know how else to put it, right? Like we're losing that human touch, that level of like comfort to talk to people about like, your concerns, right? Because you're only going to be with this person for like 10 minutes, but now I have to trust you enough to tell you that I already don't trust you, right?
Yeah. And you think of even just the word health care, it has care in it, but like how far, I mean, the stories that I hear are not caring stories. And
Mm.
that's my mission now is just to put care back into at least this procedure. The whole thing needs care and health care back for sure.
Oh my gosh, yes. We're so far from it. Like think about it right now. Like we walk into a clinic and your first interaction with a person is not a person. It is a tablet. And if you need help, heaven forbid you need help at self check-in, right? Like they're like, "Well, did you try the pad?" Yes. I have already tried the pad and it did not check me in. I need help, right? But that is their first thing to you. Well, did you try the kiosk? Yeah, I tried the kiosk. That is why I'm asking you for assistance because heaven forbid any of us need help. And I'm under 80, you
Yeah.
know. There's always some little old biddy there that needs
Yeah.
help,
Yeah.
right?
Yeah.
And you feel bad for those people. Like we're supposed to feel comfortable trying to get someone to help manage our health, right?
Yeah. And then, like you said, that lab draw process, it's all impersonal until you get to the person. You finally get to a human going to poke you. You would think, okay, finally, I've gotten to the human. This is going to be the best part. I'm going to get the best care and I'm going to get human care. And
Mm-hmm.
then they miss multiple times. And then they don't ask you what your history of being poked is. And then they're robotic in their interaction. And yeah, not humanely poking people. And I always say it's like it's a needle. It's not, it's going to hurt. Just the how numb we've gotten to the fact that I'm a human stabbing you with a piece of metal. That's gonna hurt. Yes, hopefully it's quick, but that doesn't take away the abnormalness of like, this is I'm going to stab you with a needle. Like but again, they're doing it all day long, so maybe that's why they just get so numb to it. But when we finally get to a human and then it's just an inhumane interaction, we can't have that. We have to put the care back in that interaction because it's the only human interaction you might have. So,
Oh, they also ask you for your credit card information now too. You prepay. So they stab you and they want your credit card.
oh my gosh. And I guess we've talked about it, but I kind of break it down when I think about like how to solve this problem. Okay, we can help patients advocate. So we have to help patients learn what's available out there. Clinicians and nurses, the people poking, we need to focus on them as well. And then also the people above them are arguably the most important, I feel like. That's okay. Your guest is back.
Yeah. You also want to say hi?
Hi. I love your curly hair. Hi. Are you going to be our special guest too? Good wave.
Yeah. Are you going to be an easy draw? Actually, no. I was thinking back to when you did those Billy Rubin tests on kids. That's just so terrible too.
I know. Oh, one thing I did want to ask. So has anybody ever, besides the heat pack one time
Hmm.
and then the tools, has anybody ever offered anything for pain, or said, oh, it'll hurt less if, take some slow, deep breaths, or if you do, acupressure here, or if you smell these essential oils? Nothing has ever been offered.
Nothing's been offered. They said like, if your arm hurts, you could take some like Tylenol or Advil later.
Okay.
Yeah. After I was poked, 3 times. Thank you for that. Right.
Okay.
Okay.
We have the pain of the experience, which is at least if you're going to get poked 3 times, but it doesn't hurt, then maybe it's not as big of a deal. And then we have the skill of the experience where you're getting poked 3 times. So it seems like they're only focused on the skill and trying to get the lab, but not like the experience of, hey, I'm not going to let this hurt. They're just focused on the skill. It'd be nice if people could at least, I guess I don't know, but I would assume it wouldn't be so bad being poked 3 times if it didn't hurt at all and it was like comfortable, relaxing experience. Because I was like, whatever,
Right.
I can't imagine it would still be fun, but like if it doesn't hurt and it's not causing damage, at least if it's painless, then 3 pokes are unfortunate, but it's not 3 painful experiences. But I think it'd still be better to be poked once no matter what. But
Yeah.
I can't believe nobody's offered like any intervention because that's been studied for decades as just different interventions to make lab draws, injections, IVs less painful and just the importance of that. So again, it kind of just tells me, which is just universally, we're not up to par on this, or especially with adults. In kids, we tend to care about kids' experience a little bit more with a needle because we don't want them to scream and freak out. But adults don't scream and freak out. They smile politely like you do, I'm sure, most of the time, and you're pleasantly going through it, even though it's not fun. But maybe adults do need to scream and cry a little to get this to change. But yeah, and like I said, I just encourage you to advocate. They probably don't have anything necessarily for pain available, but there are, even just acupressure points that you can do to yourself. Right in between here is one of them. Right here is another one that I've seen in studies. So just be curious if that does help kind of the process for you.
Okay.
Eat, like I said, too, is another one that everybody should have available in some way, shape, or form. Hi.
Oh.
Hi.
It's like when you have a good experience, you don't know what a bad experience looks like, right?
Yeah.
And then we learn from the bad ones.
Yeah. Yeah. Have any of your kids had a bad experience or not yet?
So far, like my son Leo had surgery in June, and I was so impressed by what they do for kids,
Yeah.
right? Like they thought about all these ways to like calm them down. Like even thinking about the surgery, they had like the little mask and they're like, oh, it looks like a dinosaur. And, we're going to put stickers on it. And they put lip smackers on it so it smells
Okay.
good. Just really fun, right?
Yeah. Yeah.
So they find ways to put kids at ease.
Yep.
And for adults, there's nothing.
Yeah.
And I don't think necessarily that adults need to be handheld, but they need a better explanation of what their risks are in general. Like I think back to like my first surgical procedure that I had. my skin had a bad reaction to the adhesive on the bandage. And I still remember the physician at like my follow up was like, well, why didn't you tell us that you were allergic to that? And I'm like, well, I've never had surgery. I didn't know that was, like this would happen. Like,
How did you not know? Yeah.
yeah. How did you not know? Well, I don't know. I didn't know that the tape would be a problem for me. I don't know.
Wasn't your top focus of, yeah.
It wasn't. So again, like you don't know until you're in it,
Yeah.
right? You don't know until you've had someone try to like dig around in your arm and then you see later that your arm hurts and that your arm is bruised until it happens to you.
Yeah. And like you said, you're trusting that they know what they're doing, even though you know
Mhm.
now that chances are they don't. But you're in a vulnerable spot. You're the one sitting there that needs this done, and they're the ones with the needle. So of course you're just gonna trust them, hopefully.
And
But
with, my bad IV experience there for a surgery, I wasn't there thinking that like the IV placement was going to do me harm.
yep,
Like that wasn't even on my radar.
yep. Nor should it really be. Yep. Or maybe it should be. We've gotten so used to pokes as just this. It's the most common procedure in the world. So of course you're going to get it done and it's not going to cause a problem. And it's like, no, it can cause problems. And we need to treat it as though it's a procedure because it is a procedure. It's a needle going
Mhm.
into your protected body. Your body's protecting you.
Mhm.
And we're breaking that barrier to and it's not like our body's just made up of veins. There's veins, arteries, nerves, lymphatic systems. There's so many things that needle could interact with, especially if you're not visualizing it with an ultrasound. So, of course, there's risks. But I'll admit, before I was ever as an expert now doing my job, when I was just a nurse at the bedside, I mean, I never thought about that. Never, our education about the seriousness
You're
of
okay.
that is far very subpar. I'd love to know what you think about, we've talked a little bit about what patients can do and what you can do next time, but
Mhm.
what about like people that are poking you? What advice do you have to people that poke for their jobs, which is a lot of us? What advice do you have for them to learn or to improve, or what should they know about being poked?
Well, I think some of them need to know that it's okay to slow down. I would rather have someone take an extra 30 seconds and be really sure that this is a good spot before poking. Not only that, ask questions. I probably at some point someone did ask me, do people usually use this vein? Because there's a small one on my arm that is a good one, right?
Yeah.
And it's okay to use a little one because it works good, right? And I think it's okay to ask a patient if that's a spot that's good, right?
Mhm.
I think so. We need, like you were saying, bring back that human element and the caring element to healthcare. I think that's really important.
Yeah. Yeah.
Like just because you have a dialogue with someone doesn't mean that we're not going to like that we're doubting your skills. I guess how do you say that, right? Like I think that sometimes you go, maybe it's like a power thing that they want you to be like trusting of their skills. And
Mhm.
if you ask questions, maybe you're doubting their skill set. But I think actually it's better. You get that human interaction.
Yeah. And none of them have a perfect record. None of us do. I'm an expert and I don't
Mhm.
have a perfect, like everybody misses. I hope someday in the world we'll never, it's far down the road, but eventually I think it's possible to almost, always have it be a one poke. But as of now, nobody has a perfect track record. So just admitting that and what can help me as a clinician help get this in one try for you as a patient? What's helped in the past? What,
Mhm.
just the humility. I'm not perfect, but I really like that one person told you. I'm looking around more because I really only want to get this in one. You would
Mhm.
think everybody has the same goal, but do they feel pressure to hurry up? It's interesting you say like that's the first thing that came to mind is just slow down. Where
Mhm.
do we get that from? Um, and I guess that's my next question, and that's where I'm kind of focusing. Like, what advice do you have, or recommendations or suggestions to facility leaders or hospital leaders, executives, lab directors, the people that are not doing the poking, but are in charge of from above, what advice or ideas for improvement for them? What do they need to hear?
Well, they need to make sure they're investing in the right tools so that they're available to their lab workers.
Mhm.
They need to make sure there's trainings, check-ins. There needs to be some sort of accountability. And I think we've kind of lost that.
Yeah, because I wonder when you're poked 3 times, how that's documented and if that's flagged in your chart as, hey, this took 3 times, or if it's nowhere to be found. And so every time you come in, it's reinventing the wheel. But like with any other, you would think, if uh even I'm just thinking like a dental procedure, you would think they keep a good record of this person needed more meds, more lidocaine, or it was really difficult for them. So next time we're going to do X, Y, and Z to improve it. The dental world's definitely farther ahead than we are in a lot of ways with needle pain and procedural
Mhm.
pain.
But again,
Yeah.
it's like going through these experiences.
Yeah.
And, to your point, if you own a hospital system and they're like, well, why does this matter? Well, it matters for a couple of reasons. One of them is if you're going to poke somebody 12 times or 3 times, it's a lot of supplies that are wasted. That all adds up cumulatively.
Yeah.
So there is truly cost savings to having a better educated staff,
Yeah.
right? And then also, patient care. Like, I'm going to be hesitant to go back and get my labs done. And how does that have a ripple effect on me calling to get appointments for other things? Because I'm not going to want to go in. And
Yeah.
then, you're going to tell me to get a lab draw and I'm going to put it off. And it's important because those are our tools, right?
Yeah. Yeah. Yeah.
Yeah.
Yeah, and it's so simple. We need to really just care about what we're putting somebody's body through. And I wonder too if like being so quick is how we get so numb to it too. Like it's just quick little poke, quick little, if that's why it just doesn't get the respect it deserves. Have you ever had a survey sent to you where it even mentions how your poke experience was of labs or anything? Like, has that ever been asked of you by a hospital system or a facility or anything to say, how was your experience of being poked?
I think so.
I mean, poked is the,
Right,
unprofessional
right.
way to say it.
But I think also because it's not even from the hospital anymore. It's LabCorp or
Like you
whatever
said.
it's called,
Yeah.
right? So it even feels even more removed.
It's more disjointed and
Yeah.
the facility, yeah, the hospital or facility, if they, yeah, have a contracted lab department, what's the hospital or facility's incentive to care about those outcomes when they literally can't do anything about it if it's a contracted facility? You would think that would be part of the contract is you need to be successful 99% of the time. You need to not cause trauma to our patients. You'd think that would be expected, but it's probably not spelled out because it is just treated as such a task, you know, task oriented and not like a humane procedure. But then it gets lost, like you said, with the accountability. Is the lab department sending out, hey, how was your experience with us? They're contracted with the hospital and they have their job. So do they really care how the experience was? Um, yeah, that's all really interesting to think about. It's a big barrier, I'm sure, to solving a lot of this, and probably part of the reason why we're still torturing people in 2025 with 3, 6, 12 pokes. I just heard about 12 pokes yesterday, a little girl who got poked 12 times. So, which is just unacceptable. So, well, we've covered a lot. I'm so appreciative of you sharing your experiences. I wish you didn't have them to share. That's my goal, is that nobody will have needle nightmares anymore. But in the meantime, while we do, I just want to allow patients to share them so that we know this is still happening now, and we still have a long way to go. Is there anything else you'd like to share or touch on that we didn't talk about that could be helpful for anybody listening?
No, I think this is great that you're bringing attention to it.
Yeah.
Yeah.
Thank you so much for sharing. I'm so sorry on behalf of all of healthcare, the healthcare providers that don't care, there's plenty. I'm sorry on behalf of them because they don't even know to say sorry. And then I'm also sorry on behalf of all of us that do care and want to make it a better experience for you and all patients. I just thank you so much for being willing to share vulnerably with the world so that we can shed a light and try to come up with better solutions. So
Thank you.